Sit down.
So I walked through these strategies, and I'd like to get your feedback in the context of the partnership framework that I laid out earlier. We're trying to deepen this coalition and the way we work together in community schools, even as we pursue these various strategies. So I'm wondering what reactions or thoughts or fatigue about what we're thinking about doing you might have. What struck you as something that was really, now that's a really big idea. I like that. That's something you should really push hard on, and or what's missing in what we do. Sarah?
I think the online assessment tool is an excellent idea. I get requests for that all the time from folks, and I really.
Okay. So more online stuff that people can actually do.
And particularly about assessment, the assessment.
Right. Right. Okay. Okay. Anything that you really like there? Don't tell me. Yeah, one thing you really like. Oh yeah, there's a handout with this. Yeah. I'm sorry, Cheryl. Does she have to stand
Yeah,
up?
I can stand up. I can stand up. So that can be- First of all, I like it all. But I have a question because the one thing I don't see in here that may be assumed under the standards bullet and research bullet. Do you have some notion about what are essential conditions? So that I think is different from standards, and I think the research looks like it shows how you know how kids achieve that. Or is it research to know what are the essential conditions that will lead to success?
So you're asking about conditions for learning for young people, correct?
No, I'm asking about conditions for the well, the end result of the learning for young people, but essential conditions for the sustainability of the communities. Am I?
Yes, no. I understand what you're getting at. I think we've done some of that in Scale Up Guide, but I'm not sure, and we have some of that in our, I have a little tools as published checklist, but we have not lifted that up in the way that you described, so that's something we could do, and certainly would be embedded in the standards of practice. Right? Although the standards would inevitably get a little more precise, although I hope not too precise. People can bury themselves in too much. Other reactions, other thoughts? What's missing here? What did you expect to see that is not here? Are we so perfect that I've only got
Outcome.
leave much more time?
Outcome.
Outcome. Say more.
What do you mean? I was talking about this at lunch when you're looking at, I was looking through the materials that you have, and I saw a lot about the students and about what community schools bring, but I didn't see where it goes. What happens to this? What makes a community school student different from a non-community school different?
In terms of their success.
In terms of their success. So, for example, one of the pieces I saw, just a little clip that talked about students in a community school have internships in local business. So for me, that would be a huge one, because that's taking you to work experience and career. So I would want to put that as an outcome. If students are connected with local businesses, it's one of your huge student outcomes.
Okay.
So that's what I'm looking for.
I think that, we have a set of outcomes that we've worked on with the field. It's been challenging. Have we come to a set of common outcomes?
Right.
Lots of work work being done on this, that's very helpful in terms of being really sharp about the results.
Because that's what we want to know, is so what's different, why is that?
Yeah,
And you know what you're doing, but what does that mean in the law?
okay, good. Good. Okay.
Two quick things, and you might already have much of this gathered. One is that focus on outcomes is important. Many times we work with communities, part of they have similar goals they want to reach that I think are emblematic of what our community goals are. So those would like to resonate. How a community moves from A to Q often feels like mystery to other communities and have gone through it. So sometimes case study methodology can really find the successes that you've been able to kind of decipher and pull the curtain and say, this is how folks did this. It's so that people's expectations and their planning and their resource allocation, they can at least assess where are we. We're not exactly like this community, but what do we know about ours and how we get there is often something we don't give detail enough.
So that's a much better description of part of what we want to do. Put back up there to the last one. You go. No, one more up. No, one down. Pathways of excellence for developing mentoring initiatives. So what we've been thinking about is, it's very hard to run a coalition that's supposed to be very broad, and it is. But you're asking a deeper question. Right, so if you look at, Tony Smith 5 years ago, 6 years ago, said we need full service community school districts, only left 2 years old family review. But what's that trajectory look like? And so we've been talking about places, and actually this has come up on the field a little bit. One is to partner in deep ways, so that we would be in a position to document that, and then others will see the pathway. Okay, so that really helps.
That's correct.
And the second thing
The
is,
second thing is about in addition to, let's see where, so maybe it goes under, I don't know where it falls, but the idea of innovative financing and funding strategies would be just one piece of this, what are the pathways that the decisions that communities have to make and the organizations with them, stakeholders around, there's a finite amount of money and resources.
right.
So how were things put together? How did one do that? And I think, again, the tools and resources that folks really need to do some of the work for them to say, here's just some innovation that has occurred that we could document in some of this may or may not work for you. I think focusing a little bit more explicitly in the, so here you have some meta studies and research, I think also with a focus on financing.
Okay. Okay. Good. Good. That's really helpful. Because people are always asking about the money side of this enterprise. Of course, when I look at the healthcare system, I simply say, they have more than enough money already. They just don't have it organized and allocated in the correct way. Right? That's my belief about our healthcare system. So some of it is about the nuances of getting those institutional players to do different. Okay. Anybody else? Are we heading in the right direction here? I'm not getting as much love as I was hoping. So I just want to be Brian.
This is slightly cheating on the strategic plan. I think it's great.
There's some love, there's some love.
But I think just to give before, we did spend a lot of time going through meeting and kind of narrow set of strategies that would be able to take the coalition through the 5 years, but also all the things that we want, all the things that we want to do, what's the kind of role of the coalition for being able to achieve some discrete deliverables that I think we have here in the plan. So for me, it's the right balance of kind of walk through with practical, big set of goals, but also not so wide that I'm going to go anywhere else and paralyzed by all the things we could be doing instead. So for us, we did take a lot of time to think through these, and I think they're in the right areas.
We've been trying to figure out what an expansion strategy looks like for the name. Should we be, working in rural communities? Right? extensively working in high poverty schools? Should we be pushing for a particular state? So those are questions that we are still kind of thinking about, because much of what's evolved has been about the vision and the strategy, and then organically people buy into it. So, it's all a question of what we think we can do to drive something and what evolves out of the workflow. So it's a challenging thing to get to. Kathleen, and then Kevin.
I think one of the things you want to know to be able to scale up is when a school chooses to be a community school, why do they do it? And so if you know that, then you know how to begin to look at a scale-up strategy.
I think that's right. I think that's what we've been seeing. What we've been encouraging is that work at the city level, at the district level. Because we've seen, as you have, I'm sure in your work, we've seen schools come and schools go. What we want is for systems to think about their schools in different ways in terms of the relationship.
So, this is certainly self-interested, but to talk about the partnering with community organizing groups and with sort of the idea of organizing in addition to advocating. And so I'm wondering whether there's an assumption that runs through this document, or whether sort of figuring that out is part of the strategic plan. So, for example, under policy, to advocate for supportive policy, would it make sense to say to advocate and organize for supportive policy?
Okay.
And under the partner, does it make sense to be explicit about that? And I don't know what you had in mind when you wrote this, and so I don't know whether it's implicit.
I think it is implicit, and we have to think through how to make that more explicit as we go forward. We definitely are very excited about the relationship with the organizing groups. We know that kind of capacity can help push this work forward. So we're going to work that through and try to make it more explicit.
Just building on that point, I think that the idea of having that as a theme, whether either explicit or implicit, running through is real important. One other place on here where it might be made explicit is to build an talent pipeline that we talk about preparing leaders in local community school initiatives. Well, what does that mean? Does that mean the professionals who run the work, or and to what extent does it mean the leadership of the community in supporting and advocating?
That's right. Okay. Libby and we've got folks who came to talk to us about health. I want to give them their due. But we've got Libby and we've got Mark. So go ahead.
I'm just going to use the word relationships. You've said it a couple times talking about the strategies, but that word isn't anywhere on this page. So I just thought that, again, that's part of the organizing and coordinating, but building relationships. I think that's something that's a key component there.
Just a quick question. This is just when I think about strategic vision, and of course we're all external partners, so it's not part of it, shouldn't be part of the conversation here, but you also have internal strategic goals and building your IT infrastructure, your communications team, and making sure you're meeting.
Oh, right.
Yeah, so that's all part of it.
Yeah, that's all going to be, I think you've heard me say it before, we've come a long way with the nice part of resources, something that we might imagine. So we're very much thinking about that, because there's a lot more demand and we need to be responsive. At the same time, we have to figure out what we're good at and what we should be partnering with, because we don't have all the assets. We're not health experts. We're not organizing experts. We're bridge builders. Okay, so John, Mark, Sean, Sue, Olga, Sue, and Leslie. So when we wanted to give this conversation a bit of a thematic thrust, and to bring out some of our partners who are working on a particular system, and to help it seemed to be natural. And I must credit Mary, when John said when Mary called, everybody just sort of showed up. So yeah, but we have these health partners, and it really is a pretty much the organizations and institutions that are deeply concerned with the health of young people and the health of people in disadvantaged neighborhoods and following families. So I'm grateful to come up and John lead this conversation. Thank you for coming. Very much.
As the group gets settled, I'll go ahead and start us off. I'm John Schlitt. I'm the School-Based Health Alliance, and very happy I would help to moderate this panel on health partnerships. And as you will see from the people, organizations represented in health, is obviously a very complex issue. All of us holds a piece of some of the health partnerships, but we all need each other in order to succeed, whether it is the public health sector, the education sector, the academic sector, primary care sector, etc. We're all stakeholders in this work, and the groups represented here on our panel today are part of that. And there are some partners who aren't at this table and who are also part of the conversation. I think about the school nurses who couldn't be with us today. Very critical partner when we think about the health of schools and the health of its inhabitants, whether students and teachers. Mary asked us to focus on partnerships. She also asked us to be brief. So what I've asked each of the panelists to do is to have 4 minutes each to give us the sort of top line thinking about what their organizations do around partnerships with community schools, partnerships to deliver better health for students and for their families and for teachers and faculty. She also asked that we talk a little about some of the federal policy opportunities that are present in the Affordable Care Act, of which there are many, as well as some of the opportunities that have been presented by Now is the Time, where there is a key focus on the mental health and behavioral health and emotional health needs of students as well. I'm going to just start off by starting the conversation with a brief overview of the convention that my organization hosted last week in Seattle. Every year, there is a national school-based healthcare convention that brings together providers from the front line in the school clinics, school administrators, advocates, researchers, academics, etc. And we talk about a number of different things about what it means to be delivering health in schools. And the partnership is the dominant theme of our convention this year, as it is every time we talk about health and health in schools. We cannot do this work alone. Most school clinics operate as a partnership between a community health organization and the school. Right there, a very critical partnership. If the school is not welcoming of that partnership, it will certainly fail. The larger healthcare systems can be very important in that partnership because when we attend to children's health and mental health needs, we can't always do everything for them on the school site, but we have links and relationships with larger systems of care. We can ensure that those needs are met. When we think about health, we also don't just think about healthcare service. We think about what is the health of the building? Is it a healthy place for children to be? What is the psychological health of the school? What is the climate? Does the climate feel accepting of all students? What is a health promoting school? What does the food look like in the schools? Are students, do students have access to healthful food options? Are the routes to school safe for children and adolescents? What about the wellness, well-being of the faculty and the people in the schools? There's so many dimensions of health that all of us are thinking about. And so it isn't just about the school nurse delivering the Band-Aid or the school clinic providing health service, but how we're thinking about health in totality. And, as important, in service to the academic mission. Because when we live in the schools, when we work side by side with the schools, that should be our primary objective. How are we advancing academic success and progress? What impact do we have on the dropout? some disciplinary actions, et cetera. So partnership is a very critical theme. So let's just start to my left, immediately with Sean. I will watch very carefully for their 4 minutes to have a dialogue about what you're hearing from these national organizations, and we'll take it from there.
Always right behind me. So I'm Sean Slade, Director of Cultural Programs at ASCD. And several of you just did 2 briefings on Capitol Hill yesterday and this morning as well about this model. So this is the primary action we've been taking around health in schools over the last 6 months and will continue moving forward. Basically, CDC, Centers for Disease Control, came to us about a year or so ago and said we would like to develop the next evolution of the traditional coordinated school health model. It's been around since 1987. And they really wanted to connect with an organisation such as ours that had more influence or more impact in the education sector. So what we came up with, we developed a consultation team and a review team as well, was a combination of the traditional school health model that you see in the blue, the whole child attendance in the green. One thing to notice about the blue is there are now 10 components as opposed to 8 components. What we have done is we expanded the emphasis on the social emotional environment and not just the physical environment. And we've also expanded the emphasis of family involvement, but also community services involvement in the school and the education process as well. There are copies, we do have a very brief little handout. There are about 25 copies now at the back desk as well. But we also, these are available also on our website, as is a video that goes along with it. The last thing I'll mention, since we only have 4 minutes to go, and you're taking some close to is one thing we also delivered was we placed this model inside the community because we wanted to make sure that people, not so much from the health sector, but especially from the education sector, begin to understand that we are working inside a community. The school is a reflection of that community. It gets its resources, it gets its students, it gets its families from that community. And so we deliberately made sure that that was signified and overt inside this model. Yes, there are some schools that you want to have an island. There are very few and far between. You're in a very strong high violence area that you may want to make a school which is an island. 99.9% of all schools should be hubs of their community. They should be feeding from the community and assisting the community. So that was a strong emphasis. That's it. I was asking.
Thank you. Hi. Please introduce yourself to us.
Sure. Leslie Parks, and I'm from the American Public Association. I'm Deputy Director for the Center for School Health and Education. And I'll tell you a little bit about our work in a moment. I'd like to first say that our model is actually very similar. And if any of you know our work, you know that we champion school as a facilitative entity in that school. And I'll make sure that in a moment. But first, I really would like to go back to the principles that we discussed earlier today for the coalition. And I didn't get a chance to say, and I'd like to use now to say that I thought health and well-being should be more prominent among principles. And the reason why is basically in this slide, it's not our model, but it is our concept in terms of what we talk about. The slide was actually developed by Steve Wolf at ECU, but this is the essence of what I would like to bring up. And that is health and education are two sides of the same coin. They're interrelated. You cannot have education without health. Most of you know that, particularly if you're in the classroom. You know that an unhealthy child cannot learn. But what you may not realize is that come from the conditions of living in poverty, you need to unpack that. What does that mean? What does it mean for children coming to the school? And to me, the essence of what a community school can do is that in addressing equity, opportunities that you refer to in the principles, what you really do is providing opportunities to change the impact. And that is how you begin to unpack poverty for these children. And in most cases, that involves something related to their health or which could impact their health down the line, as well as their educational success. So when you look at this model, you see that whether it's income resources, whether it's stress of walking to school every day, looking at abandoned buildings and having roaming dogs attack you, or being afraid of gang violence or violence in the family, that's going to impact whether you are home. And what we know is that it's going to also impact if you come to school first, what's your concentration like, what's your your mental and your emotional well-being. And so these two constantly play on one another. So that's the beginning, if you will, of the bi-directional explanation of education. When we look at it on the other side, what we also know is that if kids do not graduate from high school, they will have greater chronic disease as adults. Their children will die twice more than those who graduate. So we cannot get away from this link between health and education. It has to be called out for the relationship that it needs to education. And when you look at the contextual factors, again, that link health and education, they are those social factors. The reason that we are working in our silos trying to address all these issues is because we're not really addressing the root causes. That's what your model begins to do. I hope that's what our model begins to do. That's what the model of coalitions for Sleep Connect, Tuesday Day Society, you name it, we're all seeing that. We've got to deal with the So, okay, and I haven't even talked about I just want you to know that health is so important to education that HHS, Health and Human Services, has created in their policy guidelines graduation as an objective, a key health objective. So if you think for a minute that health and education or health is a small portion of the student success, is again, and I'd like to see it more prominent that you espouse for the coalition.
Okay, I'm Clay Balfour. I'm with the National Association of School Psychologists, and I am a school psychologist, so I'm going to focus on the mental health and overall student wellness, which is what our members, in conjunction with the school social workers and the school counselors and the school nurses, that's really the area of overall health that our members are providing in the schools. Traditionally, in the past, we've been very good at partnering with each other in the school building. My own experience, I frequently work with my school counselor and my school social worker on individual cases. And what we have been working towards over the past couple of years is educating both our members and members of the community on how to better work together. Over the past couple of years, through conversations that we've had with some of our members, visits to schools, the knowledge of not only just how to, the importance of mental health services in schools, but how they were being delivered in school ranged from, well, I know that there's somebody from downtown that comes into my school once a week, but I don't know who he is, I don't know what he does, to, oh, I have a great relationship with our community partners. We all have meetings together several times a month. We're friends, we communicate, so we noticed there was this huge variability in how schools were really working together and using all of the resources available in school and community. So one of the things that we have been working on, and I think Mary may have mentioned earlier, there's a one-pager about it on the back of the table, is we've been working on nine elements of effective school community partnerships designed to address student physical health, student mental health, and student wellness. And the goal of this is to kind of give a guide to schools and practitioners on here's really how you can best work together. It doesn't community organizations, they can't do it alone, the school can't do it alone. You really need to work together and share your data and communicate with the goal of meeting the needs of the child. That is something that we just noticed, that there is such great variability in how people collaborate. As somebody mentioned earlier, it really is all about relationships. And you have to start with a good, open relationship, and that has to be modeled among the adults. If we're expecting students to interact appropriately with one another, to demonstrate positive social skills, to work together in teams, we need to be showing that same type of behavior as grown-ups, delivering these services to schools. And so our hope is that this will really be a useful guide to schools who maybe are already in partnership with one another to help them become better, or schools are considering becoming community schools to feedback to help them figure out how to start that partnership up. And one thing that we have been working on lately, kind of related to this, is after now is the time, the president's plan came out, there were some climate transformation grants. There's been a lot of grants coming out to really focus on providing more of these mental health and overall wellness services to students. And we've had some success. We've been working with the Department of Education and the Department of Justice that when these grants go out, that one of the requirements in the application of the grant is not just to identify a partner, is that you're actually going to say, these are the partners that I have, these are the services that these partners are going to provide, and here's how it relates to our school development plan. So they're already thinking about that before they get the money. And so we just feel that if you're much more planful about it from the beginning, already have your roles and responsibilities outlined with you all. It's part of the principle. You have a shared accountability plan that you're going to have a much more effective partnership. And we've been very pleased that other people are trying to recognize that having a partner is very, very important in addressing all the needs of the student. But you need to all be working together on these needs. So we've been trying to figure this out. Our work is going to be better.
Hi, I'm Sue Colvin. I'm the Trust for American Health. I'm not sure how many folks are familiar with our organization in the room. We're about 12 years old. We're funded through private foundations like the W.J. Kellogg Foundation, Robert Wood Johnson, California Endowment, and a variety of others. And we're funded to do basically work in all things public health, prevention, and wellness related. So we spend a lot of our time trying to raise awareness of issues of obesity, for example, and then a lot of time on the policy and trying to formulate with partners how we can improve the health of Americans in every community around the country. We have very much a very heavy focus on community prevention. So outside the Beltway, people probably best know us for our reports. We do an annual obesity report that we call Episode That, although this year it'll have a new name. It'll be the State of Obesity, Better Policies for a Healthier America. And that report always has a very strong emphasis on childhood obesity. We try to raise awareness, but we know our reports, in addition to informing federal policy, also really work to inform state policy as well. We also had a new report that will come out this fall on early childhood. This will be our first foray into this particular area, but all our reports sort of follow the same format. We do state-by-state indicators, and this particular report will definitely focus on high-impact policies, again, looking kind of across the country. The other side of our organization is our advocacy and government relations work. We intersect with a lot of folks, I think, in the room on working together on things like the Healthy and Hungry for Kids Act. But we do a lot of work with different federal agencies. We spearheaded by a report that we did in 2008. We spearheaded things like the Prevention and Public Health Fund, which funds things like community transformation grants, which are efforts around the country in communities where health, education, business, providers all work together on combating obesity and tobacco use through things like improved nutrition, improved physical activity in schools. So we've been working closely with CDC. There's 6 new funding opportunity announcements that will be funded going forward for the next few years to improve community prevention. I think there's a lot of links between the work we're doing in communities, the community schools, and these community grants that will be announced in September. And then just to give you a couple of examples of existing grantees, we work very closely with a community grantee in Chicago. Chicago Public Schools is actually the lead on the grant. They funded a position as a chief health officer in Chicago Public Schools now. They passed mandatory fee legislation. They have a whole variety of work. So these grants enable work like that around the country where education is really key. So look forward to talking more with all of you.
So, just an hour of custom rights, the Center for Health and Health Services, Florence, resource technical assistance health center based out of Washington, D.C. And what we have come to realize is we have a primary funder or a significant funder or involved with lots of foundations or private foundations. And we have been the National Program Office and across the country around this idea of how to bridge these two cultures and systems together effectively so that we're closer to how outcomes and where the gaps and what can be done effectively. And so what we've really landed more recently in our examination of what unique role we could play in partnership with organizations like yours is that communities often feel like there are, and I think there are, a lot of really good effective programs that we know give us more evidence about the kinds of interventions, both at the care end as well as prevention. I think the Institute of Medicine's 2009 report around the kinds of prevention and the kinds of the value of prevention, I think has created a much stronger discourse publicly about that, and I think that's been infused, and we're seeing that in education as well as health. But what has been missing, or at least has been less developed, is a real practical set of guidance or tools on how we sustain what works. And I think that we have to really have a greater emphasis in our center around what would that mean to help communities, both sort of state and local communities particularly, think about how they would institutionalize practices and programs and keep going, knowing that our fiscal environment is one where new dollars are just not a monster for many companies. So what have we done? So I have a number of resources in the back that I hope you take some. One of which is, so to better understand, I mean, this is really informed by what we are learning from states. So we've really done some of the groundwork around informed interviews across states. We did one that sort of looked at this legs and backpacks kind of picture in front, and that's it's lessons learned from an examination and has conversations with folks around children's mental health care and the role schools have played in those state and local sort of policy environments, and what sort of innovations have sort of flourished or have started to emerge and what we can learn from that, and that's a brief that I hope you take. We've also done sort of this little guy with the backpack, see sort of like the beat there, is a brief we've done actually on case studies, looking specifically at business planning around sustaining school mental health services. So our center is really interested in health broadly and have done work in oral health and physical health centers and other models for nursing and mental health care and emotional well-being. And so we have probably because the public emphasis has, and that is my personal background, is mental health. We've looked at communities and said, how have we particularly been able to crack the nut of having school-based mental health services reimbursed by third-party reimbursement? What have you done? We always talk about that as an important strategy, but then we leave it at that in every communication that we make. What have people done that has actually made that happen in communities? We have a case study of 3 communities that I think are really we want to hold up and highlight.
30 seconds.
Okay. More recently, we have really decided that we want to think about financing mechanisms and current dollars
and how they might be used within education to support, I'm going to say, health initiatives, but they're really health and education initiatives, but they often get sort of marginalized as sort of health interventions, therefore everybody wants to help. But really, what do we know would be effective enough to use of federal education dollars, particularly federally funded ESEA programs? And what we know about the many education leaders have told us, I believe in this work, I believe in the whole child approach, I believe that, it's not just about rigorous standards and curriculum, but I can't use my education dollars for homeschool coaches or for prevention of social emotional learning. And I said, we've gone on that assumption as if it's true. Let's really tackle that and see how much of that is actually valid. And what we find when we actually take that analysis of federal education statutes, of ESEA funded programs, and out of the top 15 programs, really, they're either explicitly allowable or implicitly. And we also offer some brief sort of examples of communities that have innovated and said, I can use Title I funds for this. I can use, 21st century funds for this. I can use, a number of other funds. So what we have there is a postcard, because these are all free. I want you to share them with all of your members and communities. And so that would be available on our website. So I think we have, and what is coming is a toolkit that we hope will be available sometime in the next 6 months. Again, a practical toolkit that communities can hopefully use to determine what's important to them as communities and actually allow them to mobilize and make some impact on their policies and how they advocate for themselves around the health education shared agenda with, again, practical tools of how does one do this effectively. And I think as health, and my last message is, the conceptual work is so important, and one of the things you've on where we, I think, are less, we have more work to do in helping communities understand the practical steps and pathways that can get them there. And so hopefully we can help them too.
My name is Mark Bishop, Vice President of Policy at Health in Schools Campaign. We are a Chicago-based nonprofit organization that we work on the intersection of health and environment in the school setting. So within Chicago, we do a lot of training, stakeholder engagements, and try to train and advocate, organize around creating conditions of health within Chicago public schools. We work with parents, and we work with organizing and training parents, teachers, principals, and as well as work with the district to try to get their hand in work with them to engage in their policy work around health. While we have a lot of work on the ground, we consider ourselves a policy-based organization. And the other half of our work is our national policy work. And a lot of the work that we do nationally is really founded in the research that was done, put out by Charles Voss in 2011, the creatively titled Only Children Better Learners. Well, for those of you who are not familiar, fundamentally, it looks at issues of health within the school setting, issues that schools have proven interventions that they can make changes of the conditions of health within the school that actually have academic outcomes tied to them. So this is where that ties, I think, to help reach that direct education outcome opportunity. So that's where we base a lot of the work that we do. So in 2012, we released a report with Health in Mind in partnership with Professor Emeritus Health, which was making federal recommendations to the Department of Health, Public Human Services, Department of Education. What we thought could be done that would require congressional approval, that would require additional appropriations, things around professional development, and looking at health metrics, and looking at recognition programs. And it really spurred a lot of efforts in these areas that continue. And in 2014, we launched again the trust, and as well a number of other partners today. The collaboration on education and health. And what we are doing is taking the lessons that we learned from our 2012 report, and we are developing best practices and strategies for implementation of a lot of this work at the state level. So in our first part of the work, so in 2014, we are developing programs look at two specific department focuses. One is health systems innovation. As we look at the PARAC, we want to also be looking at
where there are ACOs, where there are community benefit programs going on, where there's health innovation grants going on, the education at the table to become linked into these resources that are newly available, and make sure that education doesn't continue to be this unfunded safety net of health within our society, which is really what it is broken. The other topic that we're looking at this year is the issue of health metrics, specifically around the issue of transparency, and that's kind of our whole word for our state school report cards. And it's kind of like where we're starting the conversation, because we think we can start there and expand out. But within that area, we want to identify what same similar idea, let's identify best practices. States and marketplace that are really looking at how do we create metrics that we can report out to the community that help communicate to our communities, to our parents, to our external partners about the condition of health within our schools. We see a couple of models, popping up here and there. And what we also know is that each of these models, as they're developing, they're all going to the exact same growing game and the exact same barriers, political barriers, informational barriers. So we want to identify what are these best practices that are happening. How can we then, establish that, share that, and come to the implementation strategy. So on these topics, this work is emerging. I'm hoping that early in 2015 we'll have reports that we can publish and share, and then move that further.
4 minutes? 4 minutes. My thanks to the panelists for meeting their very short time. So, Washington, D.C. folks to 4 minutes. Really possible. And Chicago folks, too. So,
I'm going to talk faster,
So, I hope what you heard is that your partners in the coalition who are thinking about health have vast amounts of resources and energy to provide support to this work. But while we see health as a critical component of the community schools movement, we see health as very multidimensional. So you can't just say health's at the table and not be thinking about all those multiple dimensions of health and well-being and safety. So what I think we heard Sean and Leslie say is that we cannot take them apart. Health and education are just inextricably linked. The notion of whole child, the notion of social determinants of health are so critical to be addressing them, and the school is an important and logical place for us to attend to those issues. That from Kelly, partnerships are really, really valuable, but they're complex, they're hard, and it takes a lot of effort for them to work well. So pay attention to that. From Sue, that there are incredible opportunities right now, federally in the states and localities, as we think about innovation and bringing the public health sector to more closer alignment with the primary care sector and the education sector. All that we know works. There's a lot of evidence about what works. Yes, the financing is complicated and tricky, but it can be done. It is being done. And how do we disseminate that very useful information out in the field? And finally, from more, that there are extraordinary opportunities within healthcare reform that I think we've only begun to tap into. And I can tell you that most of the architects of healthcare reform aren't thinking about children and adolescents because they don't cost us a lot of money in the healthcare system yet. But when we ignore them, when we ignore the opportunities for prevention and intervention, we are going to be able to bend the cost curve. But we just don't have any room for that conversation right now because the horizon for change is about here. But how are we fixing the duality problem? How are we making sure we better manage chronic care patients? So we have a challenging environment to work in, but so much success, as you all demonstrated. So I want to open it up to you all. Feel free to just raise your hand, ask any of the panelists questions directly if you want something for all of them to take home.
Well, I mean, one of the members of the Learning Social Alliance is the School Counselors Association. And one of the challenges that they're having is as budgets get squeezed, there's someone first to go. And they're hit, one of the things that's sort of set up as well as the counselors is to teach you And so maybe it's hard to collaborate with people who aren't there. I mean, we met a school counselor in the morning who's the only school counselor in the whole district. How, like, there's a question here. But how, it's
school counselors are seen as easy to lay off, or easier to lay off than teachers. School psychologists, school social workers, how are you as an organization and also locally trying to mitigate?
So we would, I personally and organizations say that absolutely you should not have to choose between a school counselor and a teacher. And we have worked very, very hard at the local level to maintain current positions. I know budgets are very, very hard right now, but we fully believe, and I can speak for Libby because we do a lot of work with that, is that schools really need to have access to all these professionals all of the time. Knowing, even though some schools may only have them part-time, or, they might be at center and they share schools, they need to be there. And what we've done at the state level, at the local level, the hiring decisions really are made, has been trying to show explicit data on, by having these professionals in the school, here's the number of hours that kids have been able to remain in the classroom because they're not visiting the principal or the school nurse or whatever. They're not outside of the classroom dealing with a behavior issue. Here's because, Clinton High School Council had a great relationship with the community health department. Here's the number of families that we were able to get access to other services. We've had to raise the conversation and talk about cost effectiveness, and it's much better to pay that salary of that school counselor up front than it is going to be to pay for the intensive intervention services that students might need down the road.
Are there community-based budgets that can pay for these positions, or do they have to come for social workers, counselors, and school psychologists?
So a lot of them do come from state school budgets. Most schools can use Title I funding, you can use IDA funding. The elementary and secondary school counseling program is a grant just to hire these professionals. So there's a lot of creative ways that districts have pulled lots of money in the same way that they pull lots of money to provide other types of support services. They've been creative in blending. And in some communities, there have been private donations, private foundations that have been given in kind to the school board because they recognize their staffing shortages and they give them money to go back. So it's really, really unfortunate that these are the people that are being cut. It is a reality out there that we're living right.
And if I may add just a few moments, there are also a lot of very interesting models going on around the country where schools are creating very innovative partnerships, reaching out to being part of important care organizations, being part of being part of physician groups, because there are a lot of requirements to health services and tracking them throughout the community. And what we're realizing is that our schools often come forward to be able to actually achieve goals that Affordable Care Act is starting to set. So insurance companies, physician groups, hospitals are starting to see that schools can be, need to be at the table. The issue is it's really isolated. It's really in pockets here and there. So the challenge that we're going to have, and I think it's going to be really important, is that we have to make sure that we're promoting and educating and highlighting where these innovations are happening. Because if we have to fund our health services through an education dollar, we don't have enough money in education right now. And then one more plug for one more stakeholder we can get wrong right now. Those are our custodian staff. I would argue that our custodian staff are actually our frontline banks. Healthy, and we're outsourcing them left and right. That's just on.
So let's respond, and then I want to get back out to the.
Well, first of all, I think saying that because as you were speaking, I wanted to jump in and say that I think time for innovation, first of all, we have to change the way that we do financing and change the education department. And at the Alliance meeting, in fact, we talked about this. There are opportunities for schools, opportunities for psychologists and social workers to align themselves with these new entities under health transformation, because the game now is to address those social determinants to really drive population health outcomes. And to do that now, we can look for those dollars, those dollars. And educators as well as health engineers have to be, or students that need health engineers have to be on board with
I think there is, some assumptions we're making too is that within the resources of the current way in which healthcare is funded and which care organizations and others are being funded is that there's no additional dollars. So in part, they're having to figure out how to restructure with existing dollars. Hopefully they're making smarter, better, more efficient decisions. But right now, prevention doesn't seem to be showing up too much on anybody's radar. I think we know we want to go from A to B. We're just still puzzled with how we get there with a global budget scenario that a lot of our regions are trying to deal with. So I think the promise is there, but we're going to be watching it very carefully. There was something in the back first, and then.
Yeah. I guess I'm not going to kiss the mic. So this is a related question. We work with a partner in the community organizing group in Philly, and they're now up against, and they work in collaboration with teachers union there and other groups, SEFU, probably as janitors, the custodian staff, and they're looking at these enormous cuts that have come down, where they don't have nurses in schools and children are actually dying as a result. And so when I talk with them about community schools, they're asking, is there conflict between demanding a school nurse in every school or a school psychologist in every school versus community schools who partner with neighborhood health centers? Is that, is that good? Is that excessive? Is that a conflict? What do you all?
I mean, it should be complementary. We were in Philadelphia with the Chamber of Commerce Foundation just a couple of weeks ago doing a site visit and exploring, like, for example, what Drexel's doing in the community to provide job training and leverage all these resources. It should be in collaboration. And I think what Mark said about these opportunities now, like for example, the children's hospitals, like CHOP in Philadelphia, we just met with them yesterday and they've got this whole commitment around healthy weight and helping kids manage their obesity. And they're having these collaborative conversations with school nurses for the first time. In Wisconsin, the children's hospital is actually funding school nurses in the schools. There is a paradigm shift with the Affordable Care Act and the hospitals, their community benefit programs, even outside their community benefit programs, through their community health needs assessment, are all looking at how to leverage these resources in the community. So through those processes, there are ways to begin to leverage additional resources. And that's the work that we're doing with Mark's organization, but a whole host of different organizations started beginning. Like the Split Health Alliance, we did a great partner as well.
Well, I think part of it is when you're listening, more to say about mental health, when you're looking at, do we just want to have a partner community versus having somebody in the school and a partnership with the community? From what I understand, the majority of community service providers, they're doing billable hours, and there are early intervention and prevention services that would not qualify for a billable hour that your school social worker, your school nurse, your school psychologist, your counselor, they're doing on a daily basis. You cannot meet all the wide range of health needs students if you're solely being saved by billable hours, because there's a very small percentage of services that you can do.
But we now see that with prevention services, that Medicaid is
And let me just mention also that although I talked about some of our financing kind of innovative financing kinds of tools, I really don't define sustainability just in terms of money and financing. It's about institutionalization practices and structural changes. So one, for example, is that schools do have to rely on bringing in state and federal grants, and we all talk about, and state improvement grants and a number of others. And what you want to facilitate are conversations about, okay, so now you're going to have this new initiative coming into the school, you have this new focus. Are you trying to hire new people to run that initiative, or could we look at our existing resources and how those could be
that are utilized to potentially oversee or train or implement. And so there are conversations like this happening within districts, and one of our partners, Castle, Collaborative Practical Social Learning, is doing 8 big, they're working with 8 big school districts around the country around implementing district-wide these reforms. And a lot of what they're trying to decide is how do you balance these decisions within, you always are bringing in dollars, maybe not new, you're bringing in dollars, and it's constantly a decision around who is implementing. So although I said effective programs, and some great how to sustain those, often part of sustaining those is thinking about who we have, the coaches, the other leaders already are a part of our communities, and not sort of adding on, but thinking about what they already do and how to enhance that. And that's part of the decision making.
To say, not to discount the fact that these are hard issues, because there are real territorial issues, but the reality is a lot of these territories are, in my opinion, starting to break down. Everybody knows we don't have enough buildings, we don't have enough school persons to do it all. We don't have enough school counselors to do it all. So unless we get more people at the table, it's not going to be.
And it's not just within education. I'm sorry, I just want to say this, that although I keep going back to education funding, I agree with your point that you can't just look at education. There are many communities that are getting, again, much more creative. It seems like New Hampshire and other places where they are looking at their public, the community transformation grants and other grants are going to their public health departments who know that if they want to focus on prevention and young people, they've got to partner with the schools. And we don't want them to go and have this initiative where now that it depends and relies on hiring new people. No, go to the schools, figure out who's already doing this work in the schools, and offer to supplement what they're doing. I mean, there's strategies that have been starting to be tested, and we should look to them.
I know that Marty wants to wrap up. Can we take one more question, Marty? Do you have time for that? Okay, you've got the last one.
So actually my question, your last comment, although you mentioned sort of under school professionals and coaches. So my question is actually, we've been getting a lot of, I'd say the number one request we get when we work with community school initiatives is from the educators is around more support for teachers and other school staff around mental health issues. That mental health is the number one issue that they raise as far as desperately needing more support. So my question is for any of you, what do you think in your experience are some of the best ways to support teachers and other professionals, not to become clinicians or anything like that, but to get better manage and understand mental health issues, and in some ways, I suppose, be preventive when that's appropriate. And I'll just say that we participated in a conference on trauma several months ago in New York City, and that's the educators that were there, the teachers and so forth. That's what they came away saying is, we never heard any of this information before. Why aren't we learning about this? What can we do to become better educated about this kind of thing? So that's an example, or that would be me, for example.
It's funny that you should say that, because I didn't get to talk much about our work. That's one of the things now to help educators understand exactly what this is bringing to school. I mean, we're reacting to it, as adults, parents, and educators, but really understand and get underneath to themselves work with it and to help the children solve it. That's actually a partnership.
Kelly, probably.
Yeah.
I'm sure we'll do this too.
So I'll speak from something I did when I was practicing school psychologist. This is a conversation we frequently had, and we were fortunate to have a very progressive principal, and so we would provide. One of the things that teachers had to struggle with was, they learn about child development in school, that it's very different what you learn in school and how to practice. And so we routinely, twice a year, in the same way that we give kids refreshers on what they've learned, would do that in terms of mental health. And we kind of divide the teachers up into little chunks of ages and say, these are developmentally appropriate behaviors that you're likely to see in your kids. These are behaviors when something's probably not right, in which case we had in the office on the school website a host of resources. I think most teachers, once we said, if you're worried about a student, come see the principal, come see your counselor, come see your school psychologist, whoever's in the building, probably just share that concern with them. Then we also, empower them with, here's the number for the community mental health agency. If you really are worried, providing them with just basic information, because better than their parents, but probably almost as well as their parents do. And so just providing them with information on what's normal versus not normal, put them much more at ease and letting them know that there were people in the school community that would support them. That made all the difference. And as soon as we had this training, I got a lot busier. But that really seemed to help. They just didn't have information.
Yeah, and there was actually a study that came out a couple years ago that teachers on average are making upwards of an hour every day on health issues. And so, however, professional development that receiving as a whole, that basically you are not receiving, how do you manage health issues in your classroom? It's not about being a primary care provider, being able to recognize what, how do you go about, working with your principals, sending them to a school nurse in the area, so working with schools, social workers. So, updating professional development standards has to be part of that long strategy to address mental health.
I just also say that I think we can also cover this from an education point of view with education training. So you're basically taking care of the mental health issues that you're aware of because we're trying to get the best learning environment for students. Is going to resonate better with teachers than if we say you have additional responsibility now to also be the first person who's allergic to these things. I said that the more that we can raise it in an educational perspective, you're developing the best environment and taking care of the students so they can grow and develop, it means you're likely to be taking on more wise issues.
And I'll just say that in addition to a strategy which is essential, where we're looking at professional development as a way to, in essence, mediate or provide additional information for folks who don't feel confident in classrooms today, is to also look at a strategy where we're looking at pre-professional training and in teacher preparation programs. And could we, as coalitions, could we at the national and federal level talk about who we need to bring together where we could convince each other that adding this kind of information to standard training for teachers across the board and certifications and licensures and the National Association of State Boards of Education, the Graduate Schools of Education, the Association for them, bringing those folks together because I think there are pockets of this conversation happening, but we're going to need the tipping point so that it's sort of like, oh yeah, everybody and everyone who is trained as an educator and a leader, like a principal and an administrator, should feel that they have some basic foundational knowledge that then can get enhanced with professional development. We're not there yet, but. Okay.
And that's going to be the last word. So, let me thank our panelists.
Thank you all. Hang on a quick second. I'm just going to wrap up. I was wondering why we didn't have Karen Ignati in the room. All right? You guys know. Anybody know Karen Ignati? She's the head of the American Association of Health Insurance Claims. All right? And when I heard Evie, I wanted to say, Evie, the school system is not the target for financing nurses. Personal opinion. The target for financing nurses is all those big health systems that are making lots of profit in their delivery of health services. And they ought to be put on the spot to say there are no nurses in schools, right? I know the School Nurses Association would love me for saying nurses in schools instead of school nurses. But that's part of where we have to go with. I mean, and John, I hope there's some possibilities to really continue this discussion. I think it's really important. I said to Brian, Jaffe, I said, is there a framework, right, that AASA could send to superintendents across the country that said, this is why you should be paying attention to the Affordable Care Act in your community. Here are the 6 things that you could do. They don't need to be experts, right? But I think there's real opportunity here. And it's a really important moment, as John, you continually alluded to, for us to all kind of work together. But we also have to think about the other players, right? There's all this debate about the schools and the health people. And that's all the preventative health and all our are good allies when the money is sitting somewhere.
I just want to, we've been working with the Robert Wood Johnson Foundation. There's a conference the foundation is doing October 22nd through the 24th here in Washington. And it's this whole idea of population health with hospitals and health systems, insurance, bringing all these folks together for a conversation around partnerships to build a culture of health. You might know the foundation revealed their new culture of health work and now they're restructuring the whole organization. But I think the relevant point is bringing folks from all over the country doing these innovative models to have this discussion. So Karen Ignani is one of the plenaries, I think on the first day, one of the plenary speakers, but it's going to be these models.
Great. So thanks to you all, thanks to Mary who had to leave early for getting our health friends together. We're going to have more conversations. Thanks to all of you for your help all the time in what we're trying to do. And we will get a clear vision and a sharper set of principles, and we'll send it back so you can take a look one more time. And if you have any other thoughts about strategy that you want to share, please feel free to send us an email or even better yet, pick up that old